Welcome back here to Midday Kentucky. We know bariatric surgery is an option out there for many people who are dealing with being overweight. Today we're joined by Dr. Eric Smith and one of his patients who has experienced outstanding results from the procedures offered at Georgetown Bariatrics and Surgical Services. Miss Jessica Tice, welcome to the show.
Thank you.
And Dr. Smith, we know Jessica has lost more than half of her body weight. That is amazing. Walk us through how you helped Jessica.
So we took care of Jessica over 3 years ago, and we did a sleeve gastrectomy on her, which is by far the most common procedure that we do for weight loss. You know, she came to us to try to get some help from us, and obviously not only the surgery but the support system that we've had afterwards has helped her get really good results and keep them that way.
And Jessica, you're about 3 years out from your procedure,
Yes.
correct? Walk us through how you were feeling before the surgery. What led you to seek this option?
So prior to surgery, I experienced a lot of knee pain and back pain. I would get winded very easily going up the stairs. I didn't feel very confident as a kindergarten teacher or as a parent, trying to keep up with 5-year-olds and trying to keep up with my own children.
And walk us through what made you decide to pursue this surgery. How much did you weigh before? We have some pictures that are just amazing results.
So prior to surgery, I weighed over 330 pounds, and my mother actually had bariatric surgery and suggested that might be something I wanted to look into. And so I attended the seminar, and after learning about the procedures and exactly what I was expected to do and expected of afterwards, I knew that this is what I wanted to do.
And why did you decide to go to Georgetown Bariatrics for this procedure?
I live in Georgetown, so
Okay.
it was close. The reviews that I had seen online and reviews that I had heard from other people, and then the seminar itself, just seeing what all he had already done.
And Dr. Smith, that's what a lot of people love, that you offer these seminars where they can get more information. Is this a typical story where people maybe have an idea, they want to take action, make a change, attend a seminar, and just go from there?
Yeah, it's pretty common, and you know, a lot of the patients that we take care of, they've considered surgery for years. They may have gone to a seminar, kind of backed away, and then come back 2 years later. It's an easy way. There's no commitment, you know, for patients to do it. They can do it online or they can do it in person. And sometimes people just want to come in person to either meet me or hear some comments about the surgery, have the ability to ask questions about it. And that's really where it starts. But the main thing is to make sure they're well educated on what they're getting into and what the benefits are by having it.
And what I love is that you're offering that education even post-surgery. Like you said, Jessica, 3 years out. Talk to us about the kind of support you offer after surgery to your patients.
So obviously we've got multiple visits that we have with the patient, checking things, checking labs. The first year is pretty intense. You know, we're essentially seeing patients every 3 months, and for the first 3 months it's more frequent than that. But these patients are our patients for life, and I tell them that. You know, you're going to be successful if you become a patient of ours for life. You don't wait for a problem. You know, the tendency is when you're taken care of by a surgeon, you think once you've healed that you don't come back, and it's different for this. And so we want to see patients every year, sometimes every 6 months, and we have our dietitians and our nurses that work with them constantly. We have support groups that they can attend for the rest of their life to make sure that they stay on track and keep their results.
And Jessica, now that you have these amazing results, do you have any advice for people at home who are considering this surgery?
I would say go for it.
Okay.
It does take a lot of work after you've had your surgery. It's not going to fix everything. You have to put in the effort to eat healthy and exercise and get plenty of rest, but I would do it over and over again.
Well, I can't get enough of your before and after picture. This is amazing. And Dr. Smith, these are the results you're seeing for all of your patients, right?
Yeah, you know, but a lot of this is attributed to how much hard work she's put in.
Yeah, it's definitely not the easy way out. It's just people helping themselves.
You know, it's a tool, and it's a tool that we provide patients, and it's something that we mention to patients that a lot of people don't know is the statistics show that if someone is morbidly obese, the chances of them losing weight and getting out of that morbid obesity category for more than a year with just diet and exercise alone is actually 1%.
Wow.
So, you know, very rarely would a patient go with a disease to their doctor and pick a treatment plan that they get a 1% chance of resolution. And so it doesn't mean those patients that are trying or those people that are trying with diet and exercise should stop, But when you get to that point, many times you need an additional permanent change or modality to help you lose weight. But it's all hard work to keep that off. You know, she's continued to follow the diet changes that she's made and lifestyle changes, and that's why you see the results that you do.
And you're helping your patients every step of the way, and that's why we love you coming on. And thank you, Jessica, for sharing your story with us today. We appreciate it. We're going to put up all the information up on the screen. Go ahead and reach out, find out the information to attend a seminar for yourself if you're interested. We'll also post this information over on our website and our Facebook page. Jessica, again, you look amazing, and thank you for coming in.
Thank you.
We'll see you after the break with more Midday Kentucky.